Yeah, hi, I'm Alex Murley. I'm a doctor in Cambridge. So we do a lot of PSP research here, and we've got a lot of posters here, so I can tell you about one of the exciting things that we're doing here in Cambridge. So we've got a lot of patients with PSP and CBS, CBD in Cambridge who very kindly help us a lot with research. And what we're looking here is some of the blood tests that they're giving us. So we've got blood tests on 134 patients. And what we're really looking for here is there anything in the blood tests that can tell us more about, firstly, is it possible to diagnose people or help diagnose people with PSP and CBS with the blood tests, because we know it takes people a long time to get diagnosed. And our second question is there something in the blood test, is there some marker of the disease that will tell us more about what's happening in the bodies of people with PSP and CBS that will help us either monitor the disease better or our ultimate hope to lead us forward into developing treatments. And so what you can see here in the poster is this is all of the different blood tests. So we're measuring 800 plus things in the bloods of every single person, and you can see everything above this line is things that's different in the blood tests of people with PSP and CBS. So all of these dots are different blood tests, and all of these things are different. And to be honest, we actually had to set this line even higher than we would normally do because there's so much that's different, and this has been one of the challenging things about this study. And so we do some statistical analysis that even I don't understand properly and that I have a lot of help doing. And so what we're doing here is the statistical analysis to take all of this data here and try and simplify it. And you can see the red dots are the patients with, the participants with PSP, corticobasal syndrome, and the blue dots are our volunteers who are healthy volunteers, usually actually the spouses or the carers of people with these illnesses. This is also giving a very helpful contribution to research. And you can see here there is some overlap, but there's also quite a nice clustering of the blue dots further towards one end of this graph, and the red dots are all towards the other end. And if you look down at this square here, you can see this is looking at the accuracy to see how accurately, just using the blood test, can we diagnose people with either control, which is healthy volunteers, or participants with these illnesses. And so we have PSP and corticobasal here, and two related illnesses here. It's not really the main focus of the conference here. You can see actually that the accuracy, which is in percentage, so the accuracy is 90+% for almost all of our comparisons between patients with the illness and healthy volunteers without it. So that's quite exciting. It tells us there is a lot of difference here. And then within these illnesses, there's actually not as much of a difference, which really kind of is proving our hypothesis. There's actually a significant amount of overlap between PSP and corticobasal syndrome, and it's actually using these blood tests quite hard to tell the difference. And we're then using some of the results from that blood test to go and see, is there anything in the blood test that can help us predict how long people will live for? And this is not something that's ever going to, is near making it into some clinic, but there is some evidence that there is something about the blood test that's relevant to how severe people's illnesses are, which is very promising. So this is a really exciting symposium with researchers from all around the world, and this really is trying to maximise the results and the discussion around the research that we do here in the UK, but also around the world. And this is the opportunity for us to meet researchers and to learn more about what other people are doing around the world, but also to try and build collaboration with researchers around the world. So we know this is a rare illness, and the way that we're going to make the most progress is by working together and sharing results and having open discussions about the progress we've made so far and what we can do moving forward in the future. So the message I think I give to people with PSP and CBS is firstly that the positive work and the progress that's been made so far in terms of understanding these devastating illnesses, but also the kind of exciting work that's been done and the prospects for research moving forward. So the trials that have started of potential treatments, although we don't have the results of these yet, and hopefully a lot more to come.